DreamStart stands for Dementia RElAted Manual for Sleep Strategies for Relatives, with quite a long title, but as all of you know, sleep is an enormous problem for people with dementia. As people develop dementia, they tend to become quite inactive, and their circadian rhythms tend to be out of sync, and also as most people are older, they're prone to the same physical health problems as older people and may have pain and discomfort. And sleep is often disrupted, and when people are at home, that means their relatives, their sleep is often disrupted as well, and we all need to sleep. So that means that somebody who is looking after someone with dementia can begin to find it impossible to go on, and it becomes extremely difficult. So we don't really have any effective treatments, although we have theories about what might be effective, and that's what DreamStart was. We were looking for a treatment. So this was the beginning. It's a non-drug treatment, and we were considering feasibility and acceptability. It's an intervention which is delivered mainly to the carer, although the person with dementia can join in if they want, and it's a combination of increasing light, cognitive behavioural therapy, considering things like increasing activity and getting into a routine, and considering other things that might interrupt sleep, like comfort and pain, and so we're putting them together and individualising it round the person that with dementia. So, for example, if the person with dementia was pretty much immobile, we would do chair exercises. We gave people a tape of chair exercises which they could do, whereas if they were quite active, we tried to work with them with a plan to be able to go out much more. If you don't move, you don't sleep, and a lot of people who with dementia rarely move. So that's what it was. It's a manual combination which the strategies are tailored around the individual. Well, people were quite willing to be part of it. One of our acceptability criteria was that people, how would continue with it, and about 90% of people did virtually all of it, and they tell us that they increased their activity. They were also wearing an actiwatch, like a Fitbit, and we could see that they had increased daytime activity and decreased periods where they were totally immobile, which the families told us were decreased periods when they were asleep during the day. So they mainly appeared to actually become quite enthusiastic, but we only expected people to do little bits at a time. We didn't say, go from being totally inactive to running the marathon.